Pathologists and medical laboratory professionals are at the very heart of your healthcare. They save lives every day by diagnosing your medical conditions. These scientists make 70% of all diagnostic medical decisions in healthcare. Your primary care doctor, your oncologist, your surgeon, and your child's pediatrician all rely on pathologists and laboratory professionals to make the right diagnosis at the right time, so you and your family can be treated quickly and effectively. Our job is to save lives through accurate and effective diagnoses. Your health tomorrow depends on pathologists and laboratory professionals who are making an impact today.
In ancient Egypt and Mesopotamia, the earliest physicians made diagnosis and recommended primary-based treatments. The main observation was the clinical symptoms. As used today, palpations and osculations were also used. The earliest physicians were able to identify and describe the dysfunctions of the digestive tract, heart and circulation, the liver and spleen, and menstrual disturbances. In these early ages, the medication available was only for royalty and the wealthy. When treating the middle and lower classes, less than scientific methods of diagnosis were used. Ritual sacrifices were included to predict the outcomes of illness. Sheep were killed before a statue of a god. The liver was examined for malformations. The shape of the earlobes and the common ducts were used to predict the fate of the patient. Some ancient physicians took the extra step and began to examine patient specimens. What is the value of your field to the university and to the students?
Well, MLS provides help fairs and it allows seniors to teach nursing classes.
What is the value of your field to your nation?
Well, 70% of medical diagnosis are based on medical laboratory data.
What advice would you like to share with current students to help them get the most out of their major?
I'd say be responsible in your education with your learning individually and stay engaged.
What are your job prospects in your field?
Seeing that there is a national shortage of MLS, there are a large number of prospects in this particular field.
How did you find and get your first job in your field?
Well, I went through the normal process with newspaper and HR hospitals.
How many times have you changed your job?
Well, I've had 4 total jobs, 2 in a hospital laboratory and 2 in the as an educational position.
Where have you published, presented, or performed your research?
Well, I've presented to a collaborative laboratory conference and a clinical lab educators conference.
What were your best memories of your major and the courses you took?
Well, I remember being trusted to work individually as a scientist and growing more wise.
I feel as though MLS is very underappreciated, and most people don't understand that more than half of the medical results are produced by the laboratory scientists themselves.